This conference will now be recorded.
All right, the conference is being recorded. First, as I said, we're going to talk about unique challenges that we're facing during this pandemic that interfere with our calmness. So some of these challenges might be kind of more obvious, and then some of them are going to be a little less obvious you might have not thought of right up front. So this next category, so right now we're really fortunate to live in a time where we can stay connected, educated, up to date on what's happening through technology. But there's really this growing research on, it's not an official diagnosis, but on mobile phone addiction. So as we're using more technology to stay connected, up to date, how is that also correlating with mobile phone addiction? And especially our teens and their young minds, as they're kind of known as like the I generation. So, using their iPhones, that kind of thing. So I will discuss both the pros and cons of technology and how to counteract some of the cons, because it's not realistic or even advisable to just say, let's do away with technology altogether, but how can we have technology and then also kind of counteract some of the negatives that might kind of come along with the increased use of this. Okay, so lastly, we're going to move on to this acronym I created for staying calm. So CALM. So what does that stand for? Connection, altruism, leaning on your support system, and mindfulness. So this is something both for yourself or your clients, can ask if they're feeling really overwhelmed or uneasy. When was the last time that I connected with someone? When was the last time I did something for someone else? When was the last time I leaned on my support system for my emotional needs, asked for help, saw a counselor? And then lastly, when was the last time I just slowed down and engaged in a moment of mindfulness to really be aware of my current feelings and what's going on? So, okay, so, there we go. Okay, so this quote by Dr. Ablon, we are wired to crave familiarity and predictability. So familiarity to some degree and absolutely predictability have really kind of gone out the window for the most part. So for example, most of us here are working in a hospital setting or an agency setting, and that policy changes are happening daily, so this can be stressful for both those whose policies are being changed, the team creating the policy, but it's all for the benefit of keeping everybody as safe as possible. So it's so important, but also at the same time can be really kind of create this okay, what's going to happen next? So just making choices the best we can with the information we have, even though we don't have everything. Something I kind of think of is the W questions: who, what, when, where, and why. We don't have all those answers. Okay, and then secondly with this is psychiatric disorders in the past were shown to increase after the SARS outbreak in 2003 and Ebola in 2014. So something especially interesting in the literature was that it's anxiety, depression, and PTSD were all shown to increase after these outbreaks, but especially PTSD in healthcare workers. So this information is not just for our clients, it's for us as well, because we're kind of at a risk of vicarious trauma right now, PTSD symptoms. So, okay, so next, going forward. Okay, so here are 4 unique challenges that I've found that people are facing right now. And that first one is the unknown. So with the unknown, there's many question marks. People like to fill in the blanks with these question marks. So when people want to fill in the blanks, they often create these conspiracy theories. So I heard this, I've heard that. I can't count how many times that I've heard somebody say to me, yeah, I heard, this happened, or, I was talking to a doctor and they said, they believe this has been here since middle of last year. And so all of these things kind of induce more fear and panic because there's not known. And then the panic-induced behaviors that come with the unknown. Kind of the go-to example with this is, whenever this first came out, everybody wanted toilet paper, and they had to go grab all the toilet paper, and that kind of panic-induced behavior, because I don't know if I'm going to be locked up in my house. When will I have access to this again? And so that's something to really think about. So the response to this is to maintain a facts-based presentation of the illness.
Just mute everybody.
Okay, so kind of the response I found with this is to just maintain a facts-based presentation of the illness, as well as social distancing practices. So being okay with saying, we don't have all the answers right now, but right now we do know this is what works when it comes to social distancing. We do know that this is going to be beneficial. This is what we do know about the virus, that, people of this way might be more susceptible to it, whereas, so those kinds of things, just sticking to the response. It's so easy. I mean, I know I personally have probably engaged in conversations of, what are these conspiracy theories? They can be kind of interesting, but really just holding that professional line of sticking to the facts. The next category I found that is a unique challenge right now that's kind of disrupting our peace and leading to personal distress in our culture is stigmatization. So first of all, our vaccination is social distancing. So whenever somebody becomes infected, a lot of times they're starting to feel stigmatized. So a person who's stigmatized may endure people avoiding them, not just because they're ill, but because they have this stigmatization of this person's irresponsible, this person's this or that one. That's not always the case. The person being treated with fear and suspicion, being excluded, people making critical comments about them. And so being really compassionate towards people who may have been diagnosed, because they might be stigmatized by people outside of the mental health community in their personal circle. And so also stigmatization, I found, has really affected those of Asian culture. So Asians, it has shown, have an increased level of threats online and in person, people avoiding them. And so it's really kind of a sad situation there. So just something to be aware of too. So kind of the response to this is, as mental health professionals, as healthcare professionals, we can be aware of any bias that we might have personally towards clients or patients who have become ill. What are our own perceptions of this virus? What kind of maybe judgments are we making that we aren't aware that we've made, and being sure not to bring that into the practice. Being aware of what types of questions are you asking? Are they leading? Are they judgmental? That kind of thing. So the next area that's really kind of disrupting peace in our culture is this isolation. So with isolation, social distancing, quarantining, people are facing a loss of freedom and separation from their loved ones. So these are likely to bring, an increase in anger, frustration, loneliness. It's really hard right now because people aren't used to having the connection. There's just something different about that face-to-face connection compared to seeing somebody over a screen, or, if somebody doesn't even have access to technology, not even having, that connection. So in addition, I've also realized, emotional support and grief are looking a lot differently right now than in the past, because we can't have large groups all the time to grieve our loved ones the way that we historically would have wanted to, or being able to say goodbye in the way we wanted to. And so that can be really hard, that having to separate from the people that we care about for the sake of the greater good. So something with that I've found to be helpful is, as a therapist, giving my clients really like behavioral strategies and setting goals with them to use during the week. So for example, setting goals, I might give them recommend a workbook to work on. I found a lot of my clients are kind of wanting to use this time almost as a time to recharge and reevaluate and get to connect with themselves a little bit more. So a lot of them have been really receptive to kind of self-healing type of work. You know, something else would be setting really behavioral goals and strategies. You know, my clients who struggle with depression might end up staying in bed if they don't have to get up or go to work or that kind of thing. They might stay in bed on their days off or stay in bed longer than they normally would. So we might just have a goal of, you know, getting up and making your bed every single day this week, and just having them have a goal, you know, get up and, you know, work on planting a garden, whatever might be relevant to them. And then also, you know, the last one, focusing on benefits of isolation. This isn't to discount or minimize the challenges of it, but basically the two benefits of isolation are we're saving our own health and we're protecting others. And so, you know, not saying get over it, you're doing, you know, you're protecting yourself, but kind of having that also that compassion of, you know, this is hard and we're preserving our own health, we're helping other people, you know, at this. And so, and then this fourth category that I've found throughout the research, as I mentioned earlier, is PTSD and healthcare workers. So there's some of the research I've found has shown, you know, in Millard 2020 that there's a prediction for PTSD to increase as this goes along, you know, because of vicarious trauma, it's slowly moving closer and closer to home as our clients are experiencing exposure. Some of our coworkers, employees might become ill and we're seeing them experiencing different things. So that's just something else to be really aware of. So the response to that is being sure we all take a minute and just refine our own self-care. Are we making sure we're taking care of ourselves too? You know, being able to seek support, go to counseling if we need to, you know, and it's kind of that cliche of you can't pour from an empty cup, and so being able to recharge yourself and take care of your own needs as well. Okay, so technology considerations in COVID-19. Let me get a drink. Okay, so I've made technology its own topic just because there's both the pros and cons of it, and so much information on it. So this isn't necessarily a challenge per se, but something to be aware of. So this first category, mobile phones allow for socialization, entertainment, shopping, as well as self-presentation. So as you may have seen, you know, whenever you're able to post things you care about or you're passionate about online, you know, through social media, different apps, like this is who I am, this is what I care about. You know, I've seen a lot of this as, you know, social justice is becoming really building an awareness, and people are able to say, hey, this is what I represent, this is what I stand for, and being able to present yourself and have a voice in the world whenever the world is social distancing. As well as telephone therapy has been shown to be really impactful, likely just as impactful as face-to-face therapy. So that's also another benefit. So just to reiterate, this is not about if phones are good or bad, but more what are the pros and cons. So a lot of pros with this as well. So the second area is access to the news. This is both good and bad. It keeps us up to date, but the internet gives us a lot of access to unfiltered information, unfiltered news. And prolonged exposure to this can lead to a lot of emotional distress. So the goal here wouldn't be to say, you know, don't ever watch the news, but help, you know, as I talked about earlier, behavioral strategies with clients, help them set goals of how much time they're going to allow on their phones, how much time they're going to spend watching the news. You know, I can watch news for an hour a day, or I can spend this much time doing this or that, or I can spend 15 minutes at a time, but after that I'm going to step down and walk away and do something different, kind of setting some goals. And this is just going to be, unique to who your patient is or who your client is. And then this last part on here, mobile phone addiction. So like I said, this is not an official diagnosis, but there is growing research on this field. So what it's defined as is addiction is a repetitive and compulsive mobile phone use. So this might be, if you think about the parts of addiction, the first part is obsession. So this is the craving, like, I need my phone. Where's my phone? Where did I last have my phone? You know, you might be checking your phone in the middle of this presentation because, you know, we want to know where our phone is. I'm not saying anybody here has a mobile phone addiction, but okay, so then the next part would be spending more time despite the costs. So sometimes the costs can be social, behavioral, or emotional costs, but spending time on phone despite that cost. And then withdrawal is feeling anxious when I don't have my phone. I know I've left my phone at home before. I'm saying, like, I just feel like a piece of me is missing whenever my phone wasn't here today. And so being aware of like that piece of it as well. So what are some of the social consequences? That would be like focusing on your phone rather than friends, with this feeling of obligation to keep up with your followers on social media, or an obligation to know what's going on, or caring a lot about what's going on in somebody's life, feeling like you have to measure up to somebody else's, what I call, you know, or what it's been called is like the highlight reel of what other people post is just like, you know, this thing and that thing, everybody's life looks great. So really that comparison piece. Behavioral consequences. This might be, you know, for teenagers, this might be looking at their phone rather than paying attention in class, you know, and then not learning the information. That's a behavioral consequence. Or, you know, teenagers sending inappropriate pictures to other teenagers and then getting in a lot of trouble, you know, that can create a lot of consequences, as well as emotional consequences. So just research is showing time on mobile phones is really linked to depression, anxiety. And the research I found is kind of that's two things to consider with that is both turning to your phone to find relief from real life problems and avoiding facing problems, then actually keeps you from working through your anxiety. So if I'm in a social situation, I feel uncomfortable, so I go to my phone, that's going to keep me feeling really anxious. And then on the other side of that would be that feeling really anxious then makes me want to turn to my phone. So it's kind of this cycle of I'm having unpleasant emotions, so I'm turning to my mobile phone to avoid them, and that avoidance of my emotions then leads to reinforces the unpleasant emotions, which then leads to going to the phone and kind of getting that cycle. So how can we help? So this is all really good information, and then what? So how to help? Having this awareness of these pros and cons. You know, a lot of times we take for granted this technology and might not even think to check in with our clients. Okay, how often are you getting on your phone? How often are you looking up news? How often are you, you know, spending time on Facebook or whatever it might be during your day? I was listening to the radio the other day, and this was accounted for both time in front of two screens. So they said during COVID, the average time on your phone has been about 19 hours a day. So that's also including time where I'm on my phone and looking at the TV, you know, time in front of technology. But that's, I mean, a lot of time. So it is something significant worth checking in with ourselves or our patients about. So this also exploring how with our patients, our clients, how using phones can be beneficial, but also how it can be avoidance, how they're choosing to do this instead of really sit through their feelings, sit through doing some of the work that they need to do. So I'm going to get into this more later, but teaching mindfulness can be really helpful and alleviating some of the urges to get on phones. So that can be another tool to help. So this is really not about whether it's good or bad, but more about how much, how often, and what other coping skills can our patients use to sit through uncomfortable feelings and emotions such as boredom or anxiety. Okay, so let's see. Okay, so I think I skipped a slide. Okay, yeah, just a side on CALM. So I kind of explained what CALM stands for: connect, altruism, leaning on others, and mindfulness. So when feeling in distress, look at these 4 coping skills. It's just a quick kind of thing to remember. So as well as I've written an article on just this specific part of the presentation, this how to stay calm, that I think we're going to send out as well with the presentation. So this is a resource that you can print out, pass out to clients or patients that you might see of, hey, you know, here's some coping skills to use. Because a lot of times, I know for me, I might hear one thing, but if I have paper to look at, I'm going to remember it even better. So the first one is connect. So what is that? So here I'm defining it. There's kind of 2 different parts: social support and social connection. So social support is the extent someone believes they are loved by, esteemed by, and involved with family and friends. So this is going to be really important. When we talk to our clients or patients about connecting, we don't want to just say, hey, call somebody that, you know, just to talk to them, but connecting in a way where they're going to feel loved and esteemed and involved. And then next, underneath that, social connections is the specific relationships within a community or an organization. So this could be a group membership, religious involvement, their relationship status, so like their relationship with their boyfriend or girlfriend or significant other. So this could be church, it could be friends groups, social clubs. So why is connecting important? Okay, so there's a number of reasons. College students, for example, are less likely to drop out, have lower mental health issues, increase in overall life satisfaction when they feel connected and involved in organizations. So I think, you know, thinking of your own personal experience, how do you feel whenever you're connected versus whenever you're feeling isolated? And then the second part is really relevant for me as working with eating disorders, because right now has been an especially, you know, difficult time for a lot of ladies and men who have eating disorders, that isolation piece. So group involvement and sociability are associated with improved body image and shape perception of oneself. So that might be, that's interesting, you know, why is that? You know, you might think the more you're involved with people, the more you might compare, that kind of thing. But really, women or men with disordered eating are often report a deficiency in social connection, social network. So whenever they feel isolated from others, they feel alone. So really that social connection is so important in being able to say, you know, I value these relationships and these are meaningful and feeling loved. So it's really, I mean, it's good for overall mental health, for body image, you know, a whole bunch of different levels. So how can we help people connect? Well, first of all, we want to explore connections that are culturally relevant to our clients, that lead to, like I said, feeling loved, esteemed by, and involved. So, you know, we don't want to just say, hey, try this, try that way to connect. We want to know what's relevant to our clients, and be aware of what they might be missing out on. You know, I have Native American clients who have missed out on powwows, who, you know, and that kind of thing. And so that's just one example of many, not saying everybody of a category, you know, is going to feel the same way, but just being aware, be culturally sensitive. So Another way is just looking at, okay, there's multiple different ways: online religious services, group involvement, cultural clubs. A lot of my clients have found a lot of joy in being able to write letters, to actually, like kind of talking about mobile phones earlier, to take a break from their phone and not just text a friend, but put that pen to paper and write a letter to grandma. Put that pen to paper and send a letter to, or a note to somebody that they care about. Has been really rewarding. And who doesn't like to get mail? Like, I love getting mail that's not bills or, updates or those kinds of things. So it's just nice to be able to write and receive letters. So moving along, okay, so altruism and empathy. So what is this? This is recognizing another in need with motivation to increase this person's welfare. So it's not just saying, hey, I see that you need this, but it's, I'm motivated to do something different. I'm motivated to change this. Practice of selfless concern for another person's well-being. I want to take care of you. So obviously, being able to do this, acting in this way is altruism. And then empathy is kind of the emotional precursor to altruistic motivation. So I feel empathy, I feel compassion towards this person. I'm putting myself in their shoes, and then I have this urge to act, to be able to help them. So why? First of all, it's pro-social. So as I discussed earlier, it can decrease stigmatization. So having empathy and helping people is going to go a lot further than judging people, right? So judgment leads to stigmatization, empathy leads to helping. So it's really helpful in that way, that it's pro-social. And we need, right now we need a world where we want to help each other, because there's so many reasons to be pulled apart. And then on top of that, this coronavirus is pulling us even further apart. So being able to find a way to really love and care for each other and take care of each other. It also can help patients gain a sense of value. So this is one of the more egocentric reasons to engage in altruism, but nonetheless, whether it's helping somebody else and it's helping you, it's still a positive thing. So, I'm able to help somebody else. I feel like, okay, I have a sense of value. I have a purpose. I'm doing something that I care about. And then lastly, what's really interesting was empathy was associated with academic performance and educational competencies in medical students. And so if you think about it, it really makes sense how being able to relate to your patients can help you really then draw connections, make the dots, maybe read between the lines on what's not there. So I thought that was really great. So how can we do this? So perspective taking. This would be putting yourself in another situation. Imagine what they would be feeling, thinking, and experiencing. So we can encourage our patients or our clients to do this. This isn't not how would you feel in this situation, but more if you were this person, how do you think they would be feeling? And so being able to really see what might be going on from somebody else's perspective, just kind of asking those kinds of questions. Homework for empathy could be like having them watch a movie or read a book, and then really kind of putting themselves in somebody else's position that might be relevant for them. So next, you can have them explore a cause that they might be passionate about, and contribute in some way. So what do you really care about? What's important to you? Is it, this organization or that organization? And kind of empowering them to think of, okay, what am I passionate about? And what's something I can do right now from my own home, or even get out, if I'm comfortable, and help. And then have them make a list of ways how they can help, and that can turn into one of those behavioral strategies that I talked about earlier for a homework of, okay, here's your list of ways to help, try and do one of these things a week or whatever might be however much time that they have or whatever they want to do. So that can be something that can be really helpful, is kind of helping our patients get their minds outside of what's going on with themselves and thinking out somebody else, for all of these helpful reasons. Okay, so next we have leaning on others. So this might sound similar to connection, but it's different, as that I'm defining this as seeking for professional help, asking for support. So connection is more feeling loved and esteemed by people. Leaning on others is saying, I have a vulnerable need. I need to talk to somebody. I don't feel great. This is what's going on, and asking for help, really prioritizing our mental and emotional health. So why is this important? I think I've discussed, earlier that crisis right now is a risk factor for PTSD, anxiety, depression, suicidal ideation. So it's really important right now to lean on other people, as well as to avoid burnout and mental exhaustion for ourselves, for us in the healthcare community, healthcare professionals. We want to be able to help, and we also need to be able to take care of ourselves, be willing to take care of what our needs are. So how can we do this? So this might be through professional counseling services, personally relevant support programs. So some of those might be Narcotics Anonymous, Alcoholics Anonymous, Overeaters Anonymous, grief groups. As I talked about earlier, that grief isn't able to look the same as it always has. And so, going in and, searching for grief groups, that can be really, really helpful. And then pastors aren't licensed therapists, but they sometimes can help as well. So that could kind of technically fall under this umbrella of leaning on your support system. Where do you go? I think we all have the spirituality and being able to attend to that too. So as well as I've added, that a lot of times our patients or clients have an employee assistance program which offers free therapy for a few sessions. And so I've added the St. Francis employee assistance phone number. If any of you are listening to this or watching this and you're, if you're work for St. Francis and you want to jot down this number, it might be worth giving a phone call. So okay, so next we're going to go into mindfulness. So what is mindfulness? Okay, so it's noticing what is occurring inside of you and outside of you in the present moment without judgment. So that important part of without judgment. So what's going on? So why should we do mindfulness? Why is this helpful? What's the purpose? So uncomfortable situations often, as I talked about earlier, lead to turning to our phones as a buffer. So mindfulness helps us to say, what, I'm going to sit in this uncomfortable moment and experience it without then avoiding it, which then builds up, resilience, self-esteem, those kinds of things. It's negatively correlated with depression and anxiety. So as mindfulness goes up, depression and anxiety goes down. As I mentioned a minute ago, increase in self-esteem, life satisfaction, resilience, those kinds of things. And then realistically accepting your situation helps have more positive attitudes towards the future. So if I'm accepting what's going on, then I can feel more equipped to deal with the future, rather than I've been numbing myself, I've been kind of avoiding my feelings. That's going to make me feel more fearful of the future, because I'm not really feeling like I can handle what's to come. But whenever you're able to sit through that discomfort, you might not know what the future's going to hold, but you're going to know that you can make it through it because you've done it before. And mindfulness is one of those tools that helps you just sit through being uncomfortable. As much as we all don't like that, it's so necessary. Let's see, looking at my notes. So I'm going to move on to the how. So how can we be mindful? There's kind of two different things, the what skills and the how skills. So what do we do in mindfulness? We observe, we describe, and we participate. So observing is observing and noticing what's going on inside of you and outside of you. So what's going on inside of you is that might be what your heartbeat feels like. You know, 5 minutes before this presentation, my heartbeat felt a little bit faster because I was getting nervous and excited for this presentation, you know, and just noticing it without judging it of, oh, that's good, that's bad, that's, you know, this or that, just noticing, you know, I feel a heaviness in my chest, or my hands feel clammy, you know, different things that you might notice. And then what's going on outside of you? Think your five senses. So what do you see? What do you smell? What do you hear? What do you taste? Those are kind of the observing those things. So then describing. So descriptions are not judgments. So you would describe like you were giving information and avoiding, this is important, labels like good or bad, right or wrong, worthwhile or worthless, should or should not. Another one I go to is fair or unfair. So kind of avoiding that language as you describe, but you might be able to use the words of this is hard or easy, this is comfortable or uncomfortable, but not that language of good or bad, right or wrong, you know, whenever describing what you're sensing with your five senses or feeling inside with your body. Okay, so let's see. So participating. So this would be engaging in the moment all the way. So mindfulness is doing it all the way. I'm going to fully participate. I'm going to do this like I've never washed these dishes before. I'm going to do it all the way. I'm going to, you know, do this activity, whatever it is. I'm going to sit out here and watch these birds like nobody's business. I am doing that. These birds in front of me are the most important thing. I'm jumping in all the way. I'm not also texting my phone while, you know, trying to be mindful and really staying focused on the thing. So the how skills really are tied into the what skills. They're but just kind of different language for them. So non-judgmentally, avoiding good or bad. You know, nothing you feel in your body is good or bad. Sometimes it's pleasant or unpleasant, you know, or even the act of mindfulness. I've heard before, I'm going to be honest, it can be a little boring. So avoiding words like this is worthwhile or this is worthless to do. What's the point? But more trying to, and as you have those thoughts, watch them just kind of float away on a cloud in your mind, that kind of thing, because we're human, those thoughts do come. But trying to avoid that language and just observing, and as you have it, then draw your attention back to the moment. And then again, one mindfully, so that would be, you know, just doing the one thing, doing it all in. So I think of one mindfully as no multitasking. So you're either listening or reading or whatever it might be. I also think of it as like imagining yourself doing something. If you're doing mindfulness for what's going on outside of you, doing it like you're seeing it for the first time. So walk out and to your front yard and look at that view like you're from somewhere else. You're from a different region. I've never seen trees like this. I've never seen whatever it might be. I've never noticed this before. What? Like think of yourself of looking at it through the eyes of somebody who has never seen these things before. So let's see. So I think that wraps up the lecture. Here's our references, but does anybody have any questions? Pull up the chat. give a few minutes. Okay, we have a question on coping skills to use that might be helpful other than the calm. So another thing I really love to go to is distress tolerance skills. So one of my favorite distress tolerance skills is acronym TIP, so TIP. So what is T? T is temperature. So this is for if somebody's in such emotional distress that they're not at a place where, you know, they can use mindfulness or that kind of thing, that they're just like, I think I'm going to have a panic attack. Temperature is doing something to change the temperature. So putting cold water on their face activates the dive reflex. So it kind of slows down the heart rate, slows down the breathing, kind of shocks you out of that panic. It could be taking a cold shower, holding an ice cube, that kind of thing. The I is intensity. So doing something that's really intense that kind of gets all those feelings out. So that might mean punching your pillow or turning on a song like that really gets you going and just dancing to it, that kind of thing. And then P is paired breathing. So it'd be like inhaling, you know, and really squeezing your muscles, and then exhale and just kind of let it all go. So breathing paired with like muscle tension and release. So that's something I like. I also, another coping skill that I really like is first aid kits. So that can be another behavioral goal, is have your clients or patients build a mental health emergency kit, first aid kit. So we have those for whenever we like cut our arm and need a band-aid. We should have them for mental health as well. So that can include whatever might be relevant for your patient. You know, it might be a box that has pictures of their pets in it, or has fingernail polish, so they can paint their nails and relax, you know, or it can have a coloring book, so it's something that they can do. So just kind of building a first aid kit can be really cool. It could have a stress ball in it that you could squeeze, so that kind of thing. So yeah. See if there's any other questions. Okay, let's see. There's a question on resources for clients when in distress beyond being able to use their coping skills. So kind of with the distress tolerance, I actually have some resources. So there's a few different hotlines that clients or patients can use if they're feeling in distress. So one would be like the disaster distress hotline. So whenever anybody's in distress, they can call this number, have somebody to talk to. COPES is really helpful if somebody's having suicidal thoughts, homicidal thoughts, they can call COPES, as well as the National Suicide Prevention Hotline can be really useful as well. So yeah. All right, well, I think that wraps up. Unless we have any more questions, I'd be happy to answer. Okay, thanks everybody for attending. Have a great day.
Thank you guys all so much for being a part of this incredible webinar. I know I learned so much. I just wanted to say that I will send each of you a copy via email of Morgan's article that she wrote, which is of the same title. If anybody needs anything or have any question, feel free to reach out to me at, I'll say my email address. It's pronounced lawbrands@stfrancis.com, but that's LA and then BRANZ at spelled out stfrancis.com. So if anybody has any questions or wants any additional resources, please feel free to reach out. We're so excited that you guys got to join us, and we hope to see you next Friday, not Saturday, next Friday. See you soon. Here we go. Thank you guys.